Cancers of the head and neck are malignant tumors that occur within, most frequently, the upper aerodigestive tract, which really in common terms means your mouth, your nasal passages, your throat, your voice box where you swallow and speak, as well as within the salivary glands. These can also occur within lymph nodes and also include thyroid cancers. Symptoms that people have when they have head and neck cancer vary depending on the location. If you think about where things occur within the head and neck, they have different function, different form, and so therefore different symptoms or signs often occur. So for example, with tongue cancer or cancer of the oral cavity, you'll have something within the mouth or on the tongue, which is a non-healing sore or a wound or an ulcer, usually red with raised edges or something like that for usually several weeks or longer. For voice box cancer or cancer of the lower part of the throat, that can often be problems swallowing, changes in the voice, pain in the neck or a sensation of something being there. Those can also present with neck masses as well. Fortunately or unfortunately, we have some risk factors that are controllable and others that really aren't for head and neck cancer. So for example, risk factors that increase risk for patients would be a history of smoking, chewing tobacco, alcohol use. Those are frequently the types of things that can lead to malignancy within the mouth or the throat that we commonly see. The flip side of that is many cancers of the head and neck, including even tongue cancer and especially tonsil invasive tongue cancer, have no risk factors besides human papillomavirus related infection in the case of a tonsil cancer, or just an unusual presentation where non-smokers can get tongue cancer or cheek cancer, for example. Screening is something that still has a need for further data. Very often we get referrals from patients who notice something and then they might present to another otolaryngologist, an ear, nose, and throat doctor, or to their dentist or oral surgeon, and then those referrals often come to us. So sometimes a screening is as simple as noticing something abnormal, a growth or a mass or a lump in the neck or a change in the voice that's different than what they've had before. And so I would say someone who has a change or, for example, unintentional weight loss for more than a few weeks is someone who should get screened by a head and neck surgeon. Other patients who may be at higher risk, as we mentioned regarding risk factors, are smokers. Even if they've quit, the risks persist for many, many years after, as well as people who have smokeless tobacco use or long-standing alcohol use. I'm Dr. Greg Ward, and I want to thank you for listening to this information about head and neck cancer. And I would certainly encourage anyone who feels that they might be suffering from one of these diseases to seek medical attention, and then we can get you in for an expert referral.